My name is Nicholas Dewald, and this week the differential diagnosis is thoracic outlet syndrome. We're going to be starting with a series of orthopedic tests. First, we're going to be doing foraminal compression. For foraminal compression, I'm going to have my patient sit up straight. I'm going to go ahead and apply downward pressure. I'm going to rotate, apply again, rotate, apply again. The positive here is pain either localized or radiating cervically, and for localized pain that would indicate facet pathology without nerve root entrapment, and with radiating pain that would indicate facet pathology with nerve root entrapment or nerve root compression. Next we're going to do Jackson compression test. For Jackson I'm going to rotate laterally flex the patient's head, and then I'm going to apply pressure into the facets. Laterally flex to the left, into the facets here as well. The positives would be the same. You would be expecting localized or radiating cervical pain. Localized pain would indicate facet pathology without nerve compression, and then radiating pain would indicate facet pathology with nerve root compression. And from there, we're going to move on to the maximum foraminal compression test. So for this, I'm going to rotate and laterally flex my patient's head. I'm going to hold it there. And with that, you would expect pain, any cervical pain, any pain of any type would indicate foraminal encroachment. From there, we're going to go to cervical distraction. For cervical distraction, I'm going to contact right underneath the patient's mastoid. I'm going to lift up gently on the head. For cervical distraction, the positive would be decrease in either that local or radiating pain, and so that would be then either a facet pathology with nerve root compression, or in radiating pain it would be in localized pain it would be facet pathology without nerve root entrapment, and in radiating pain it would be facet pathology with nerve compression. And so from there we're going to move on to the Roos test. And for Roos test, I'm going to have you hold your arms out in front of you. I'm going to have you bend your elbows to 90 degrees and make a fist. And then I'm going to have you externally rotate your hands and open that fist, like this. And I would have the patients do this for about 3 minutes. The positive here would be any numbness or tingling or paresthesia in those arms, and that would be an indicator of thoracic outlet syndrome. From there, we're going to go to Adson's test. For Adson's test, I'm going to have the patient sit up nice and straight for me, and I am going to take and find the radial pulse. And now I'm going to have the patient take a deep breath and turn your head to the right. And then I'm going to have you, hold that deep breath, I apologize. Take a deep breath and hold it, turn it to your right. Okay, you can let go, there's still a pulse. And now I'm going to do the same thing on the left side. I'm going to find the radial pulse and elevate this arm about to the midline. And then I'm going to have you take a deep breath, rotate your head left. And now rotate right. And the positive for this would be paresthesia, pain, pallor, or there would be a decrease or absent pulse. And the indicator for this would mean that for Roos's test, that this would be an indicator of thoracic outlet syndrome. And now from here, I'm going to move on to, I apologize, that was for Adson's test. Adson's test would indicate neurovascular bundle entrapment between cervical rib or biscalenus anticus. From there, I'm going to go to Eden test. For Eden test, I'm going to take the patient's arm and I'm going to establish radial pulse, and I'm going to lift it. I'm going to abduct it, and now I'm going to have my patient sit straight up, push their shoulders back, stick their chin to their chest, and take a deep breath. And there's still the pulse, and I would repeat the same thing bilaterally on the left side as well. And for the Eden test, the positive would be pain and or paresthesia and pallor, absence of pulse, and this indicates compression of the neurovascular bundle by the clavicle or the first rib. So it's different, obviously, than Adson's test. And so now I'm going to move down to the right test. Right test, I am going to take the patient, I'm going to find their radial pulse. I'm going to take it from the neutral position. I'm going to slightly abduct that arm to full abduction, and she still has a pulse. I'm going to repeat this on the same side. or on the left side. I'm going to raise the arm. Still has a pulse. And the positive for right test again would be pain, any type of paresthesia, as well as absence in the pulse. And this would indicate compression of the axillary artery by pectoralis minor, and this would also indicate thoracic outlet syndrome. So for that, we're going to go to tendon elbow, and for tendon elbow, I'm going to roll this up. Awesome. And what I'm going to do is stabilize the patient, and then I'm going to tap in between the olecranon process and medial epicondyle in that groove. And the positive for tendon elbow would be radiating pain down the ulnar nerve distribution or pain in that area, and that would indicate ulnar nerve entrapment. Now for here, I'm going to do triceps, biceps, and brachioradialis reflexes. So I'm going to start with the biceps reflex. I'm going to have roll your sleeve up here. And I'm going to have you relax your arm and have you make a fist. And what I'm going to do is I'm going to traction down on the bicep. Do this on the other side as well. I'm going to traction down on the bicep. Traction down on the bicep. And then I'm going to tap. And now I'm going to go to the brachioradialis reflex. I'm going to have you flip your hands over like that. And I'm going to come down to the brachioradialis. And then from there, I'm going to move around and I'm going to do triceps. Triceps tendon. On the triceps tendon on that side.